day and Assalamualaikum ma'am. I am your student nurse Alaya Lumantong Dalidig, and today's video I'll be doing the return demonstration of bag technique. The definition of this is that bag technique is a tool that brought by a nurse during her visits that will enable her to perform the nursing procedure with the ease and have time and effort for the rendered care. The purpose for this is that to provide the organized, systematic ways of utilizing the available articles, supplies, and equipment that can be used during the emergency need and to maximize space usage of the bag. And also the bag techniques saves times and efforts when doing an emergency nursing procedures and arrange the contacts or contents of the bag, a convenience and for effective rendering. The equipment that we will be needing are the plastic lining, waste bag, surgical scissors, bandage scissors, sterilized syringe, thermometers, apparatus, cotton balls, apron, hand towels, sterile gauge, forceps, tape measures, plaster, alcohol lamps, soap dish, sterile needles, clean gloves, and baby scales and test tube. The thing that we will need it to be considered before, during, and after the procedure is that to maintain the steriles of the bag and to prevent contamination.
Upon arrival at the client's home, place the bag on a flat surface or on a table lined with a clean paper lining, clean side out, fold part touching the table. Put the bag handles or strap beneath the bag. This is to protect the bag from the contamination. Ask for basin or water or glass of drinking or tap water. If faucet is not available, place this outside the working area. This is to be used in hand washing. Open the bag, take the linen, plastic lining, and spread over the work field area. The proper lining clean side out. This is to protect and promote efficiency of the healthcare provider. Take out the towel, soap, dish, and apron and place them at one corner of the work area within the confine of the linen plastic lining. This is to prepare for hand washing and to protect the nurse uniform. Wash hands using soap and water. Wipe to dry with towel. Leave the plastic bag of the towel in a soap dish. This is to prevent the spread of microorganisms. Put an apron right side out of the wrong side with the crease touching the body. Sliding the head into the head strap, neatly tie the strap at the back. This is to make sure that the apron is put in tightly. Put out things that most needed in the rendering nursing care. For example, thermometer, kidney basin, cotton balls, waste paper bag, and place it at the corner of the work area. This is to have an organized work, also to save time and effort. Place paper receptacles outside the working area. This is to avoid transmission of any microorganism. Close the bag. This is to prevent contamination. Proceed in performing the necessary nursing care and treatment. This is to provide necessary nursing care to the client. After rendering the treatment, clean and put alcohol on items used and discard soiled supplies. This is to avoid spread of any microorganism. Perform hand washing again. This is to avoid transmission of microorganism. Open the bag and return the items with that were used in their proper places. This is to have the organized content of the bag. Remove the apron and fold it back by holding it away from your body. The soiled side in and clean side out. Place it in the bag if it is not soiled. This is for that placing soiled items in the bag will surely contaminate the clean ones. Clean and fold the lining. Place it in the bag if not heavy soiled or throw it in the receptacles if heavy soiled and close the bag. This is to unsoiled proper lining can still be used. Document all necessary data gathered, observation, nursing care provided, and treatment rendered. Give instruction for the client for cares of clients in the absence of the nurse. This is for proper documentation of treatment is responsibility of a nurse. This will also save as a reference in future consultations or treatment. Make an appointment for the next visit. Serve as the reminders to not be forgotten.